Morphine sulfate patient-controlled analgesia vial is a medication used to treat severe pain. It belongs to a class of drugs known as opioid analgesics and works in the brain to change how your body feels and responds to pain. It is typically used in hospital settings for patients who require constant pain relief. The vial allows patients to control their own pain medication by pressing a button that delivers a dose of morphine when needed. The dosage and timing of administration will be determined by a healthcare professional based on the individual's pain level and response to the medication. It is important to follow the instructions provided by the healthcare provider to ensure safe and effective use of the medication. This medication can be given by injection into a vein, muscle, or under the skin. It can also be given as an injection around the spinal cord or into the space that contains the spinal cord. Depending on your specific product, you may need to use an infusion pump placed under your skin for continuous injection at home. The dosage is based on your medical condition and response to treatment, and for children, it may also be based on weight. It's important to use this medication at the first signs of pain, as waiting until the pain has worsened may make the medication less effective. Before using, check the product visually for particles or discoloration. Clean the injection site with rubbing alcohol before each dose. If nausea occurs, consult your doctor or pharmacist for ways to decrease it. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. If the medication stops working well or if you have any concerns, talk with your doctor. Some common side effects of using this medication include nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, increased sweating, or dry mouth. You may also experience pain, redness, or swelling at the injection site. To prevent constipation, it is important to eat dietary fiber, drink enough water, and exercise, and you may also need to take a laxative. Ask your pharmacist which type of laxative is right for you. To lower your risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, you should tell your doctor right away if you experience any serious side effects, such as interrupted breathing during sleep, mental/mood changes, difficulty urinating, vision changes, slow/fast heartbeat, severe stomach/abdominal pain, or signs of your adrenal glands not working well. Seek medical help immediately if you experience very serious side effects, including slow/shallow breathing, fainting, severe drowsiness/difficulty waking up, or seizures. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, make sure to contact your doctor or pharmacist. If you experience any side effects, it's important to consult with your doctor. Morphine sulfate patient-controlled analgesia vial has the potential for abuse and addiction, which can lead to overdose and even death. It may also cause severe breathing problems. To lower the risk, your doctor will prescribe the smallest effective dose for the shortest time possible. It's important to have naloxone available to treat opioid overdose and to educate your family about the signs of an opioid overdose and how to treat it. When starting this medication or after a dose increase, the risk of severe breathing problems is higher. Using morphine with alcohol or other drugs that cause drowsiness or breathing problems can lead to serious side effects, including death. It's crucial to understand how to use morphine and which drugs to avoid while taking it. It's important to keep this medication in a safe place to prevent theft, misuse, or abuse. If someone accidentally uses or swallows this drug, seek medical help immediately. Women of childbearing age should discuss the risks and benefits of using this medication with their doctor. If pregnant or planning to become pregnant, it's essential to inform your doctor. Morphine use during pregnancy may slightly increase the risk of birth defects, especially during the first 2 months. Using morphine for a long time or in high doses near the expected delivery date may harm the unborn baby. It's important to use the smallest effective dose for the shortest time possible to lessen the risk. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's crucial to notify the doctor if any symptoms are observed in the newborn. Before using morphine sulfate patient-controlled analgesia vial, make sure to inform your doctor or pharmacist if you are allergic to it or to other opioid pain medications, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions. It's important to discuss any medical history of brain disorders, breathing problems, gallbladder disease, kidney or liver disease, mental/mood disorders, substance use disorder, stomach/intestinal problems, disease of the pancreas, or difficulty urinating with your doctor or pharmacist. Be aware that this medication may cause dizziness or drowsiness, especially in older adults. It's important to avoid alcohol or marijuana while using this medication, and to not drive or use machinery until you can do so safely. Make sure to inform your doctor about all the products you use before having surgery. If you are pregnant or breastfeeding, discuss the risks and benefits of using this medication with your doctor to ensure the safety of your baby. It's important to be aware of potential drug interactions with morphine sulfate patient-controlled analgesia vial. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with morphine sulfate patient-controlled analgesia vial include certain pain medications, naltrexone, and samidorphan. Using this medication with other products that may cause drowsiness or breathing problems can increase the risk of serious side effects. Be sure to inform your doctor or pharmacist if you are taking other opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, be cautious with other over-the-counter medicines, such as allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always check the labels and ask your pharmacist about using those products safely. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure that lab personnel and all your doctors are aware that you are using morphine sulfate patient-controlled analgesia vial. If someone has taken too much morphine sulfate patient-controlled analgesia vial and is experiencing serious symptoms like passing out or difficulty breathing, give them naloxone if available, and then call 911. If the person is awake and has no symptoms, contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of overdose may include slow or shallow breathing, severe drowsiness, and coma. It is important to remember that this medication is prescribed specifically for your current condition. It should not be shared with others, as this is against the law. Additionally, do not use this medication for any other condition in the future unless directed to do so by your doctor. If a different condition arises, a different medication may be necessary. If you happen to miss a dose of this medication, take it as soon as you remember. However, if it's close to the time of your next dose, just skip the missed one and take the next dose at your regular time. It's important not to take a double dose to make up for the missed one. As always, consult your healthcare provider for the best advice on managing your medication. Make sure to store the morphine sulfate patient-controlled analgesia vial at room temperature and away from light. Different brands or packaging of this medication may have specific storage requirements, so be sure to read the package labeling or ask your pharmacist for the proper storage instructions. And as always, keep all medications out of reach of children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.